Good morning. My name is Tracy Trypuc. Welcome to Your Health Matters. Today we will be discussing several important health topics, including the importance of knowing your family health history. And now I'd like to welcome my guest, Dr. Benjamin Weeks, a biology professor from Adelphi University in Garden City, New York. Welcome, Dr. Weeks.
Thank you.
Thanks for being here. Dr. Weeks earned his PhD in 1988 from the Center for Environmental Health at the University of Connecticut. He worked for 5 years at the National Institutes of Health in Bethesda, Maryland, and was a research assistant professor of medicine at the University of Pennsylvania prior to joining the biology department and environmental studies program at Adelphi University. Dr. Weeks' research in general investigates mechanisms of disease and development with a focus on how environment pollutants cause disease. Dr. Weeks teaches the genetics and microbiology courses for the nursing program at Adelphi University. Welcome again, Dr. Weeks.
Thank you.
I'm happy to have you here to discuss this important public health topic. In 2004, the Surgeon General declared Thanksgiving to be National Family Health History Day, encouraging families to talk about and to write down the health problems that seem to run in their families. The Surgeon General launched this national public health campaign called Surgeon General's Family History Initiative. The idea behind the Surgeon General's initiative is to get families to discuss, whether it be during family gatherings such as Thanksgiving, or at other times, to discuss and write down any medical conditions that run in their families. Studies have shown that while Americans realize the importance of knowing this information, a recent survey found that only about 1/3 have ever actually tried to obtain and write down their family's health history. Family history is an important risk factor to know and to inform your doctor. Can you explain to our viewers why this is so?
Yes, of course. Your family history is important because you are inheriting genetic markers, genetic factors from your family. We know this for a long time. And some genes and certain sets of genes can put a person at risk for diseases. So we're talking about risk management. Knowing your family's health history tells you something about your risk. And when you know your risk, you can then share that information with your doctor, share that information with your family members, and that will help with prevention and also perhaps certain decisions that surround treatment. So knowing your family health history, knowing your background, genetic background, will help you assess risk, manage disease, and will help your family do likewise.
Okay. So, can you explain why this is important then for the family health history to be like written down? As elaborate
Yes.
a little further as far as like nature versus nurture and environment and healthy
Sure.
lifestyles
Absolutely.
in addition to genetics?
Yes, so of course we inherit our genes from our predecessors, and this describes our nature, what we're made of, and pretty much sets an outline or a set of boundaries within which we operate. However, what we actually do with our lives in terms of lifestyle, our diet, our nutrition, whether we smoke, other habits, drinking, can influence whether these genetic markers or this genetic background really does contribute to disease or not. So while there are single gene mutations, which if you inherit, pretty much say you're going to get some form of disease, maybe it be a cancer or cardiovascular disease, there are also multifactorial issues where you can have multiple different genes involved and environmental factors involved, and you can't simply say, well, you know, you're destined to have a particular disease because of your genetic background. What are some of these other things that can affect what you need to know about your family health history? Well, it's good to know what was your parents' job, employment? Were they obese? What was their diet? Because all of these things also influence what their health will be and what your health might be and what your risk factors are. So it's not always knowing your family health history doesn't simply mean knowing your genetic background. It also means knowing occupations, obesity, habits, patterns of behavior, lifestyle, not only of yourself, but of your family.
Okay, so what I hear you saying is it's not just important to know what their genetic history is, but also how they live their lives and where they live their lives.
Yes, your family history, your family health history will go beyond what the genetics are. The genetics sets the nature, the foundation, but what you do with that, the nurture part of it, can also have an important influence, not only on what you do, but on what you learn from your family and recording that down and passing that down.
Okay. So in obtaining and recording your family health history, which members of your family should you include in this family health history?
The best answer is to say, of course, the more the better. So the more people you can know in your family and share your information with, the best. Really, if you know your parents' information, this is fundamental. But knowing their siblings or your aunts and uncles' information is also very helpful. Ultimately, you're trying to know what your grandparents' genetic background is because that can influence your health as well. Likewise, if you're sharing your health history and you would like to know your aunt and uncle's health history, your parents' health history, you might want to also be talking to your nieces and nephews, and of course sharing that information with physicians. But in terms of the people you want to get in knowing their health history, parents, uncles, aunts, grandparents if possible, these are the people you want to know.
So what kinds of questions should you ask them? Like, do you have any chronic diseases such as heart disease or diabetes? Have you had any other serious diseases such as cancer or stroke? Or how old were you when you were diagnosed? What is your family's ancestry? If relatives have died, what did they die from and what was the age of their death?
Right, those are great questions. And of course, if you're looking at diseases that have single genes involved, which are very predictive of and definitive in terms of acquiring a disease, you would want to know not just did they die from cancer, but what type of cancer, because certain markers will be associated with different types of cancer. You would want to know, again, occupation, lifestyle of the family members. You would want to know about immunological diseases. There are markers that will affect immunological diseases, mental health diseases. Bipolar depression has genetic predisposition. Cardiovascular disease, cholesterol levels, all of those going toward the understanding what the genetic background and the makeup is of your family, as well as, of course, all these other environmental issues that you want to ask about.
So once you have this information, obviously it's important to write it down and then share it with your physician. It can be written in a notebook and updated yearly or in a computer, and people can use the tool that's created by the Surgeon General called My Family Health Portrait. Once obtained, what should our viewers do with this information? They obviously keep it updated yearly or as new information comes to them.
Right. Well, the family portrait that you mentioned is available on the Health and Human Services website, hhs.gov, and that's a great service to go to because it will help you format the information. Once you have collected that information, certainly you would want to give it to your physician. That's going to help you with your health. I would also suggest giving it to your children's pediatrician so that they have a record of that going forward. Of course, writing it down, keeping it in a folder. You might put it in with your filing cabinet with all of your other important household information and keep it there. I would also recommend, if you can, to share it with your nieces and nephews and their physicians, if that's something the family would want to do. And getting it into the physician's hand is very healthy because the physician can use that information to do better screening, earlier screening for diseases, even affect what kind of treatment decisions they might make. So getting it into your physician's hands, saving it, but then also getting it into your children's physician's hands and maybe your nieces and nephews' physician's hands, that's a good place to get it. Yeah.
That's very good. Good to know. And we're speaking with Dr. Benjamin Weeks about Family Health History Day, and we'll be right back after these messages.
Hi, I'm Tim Stead. I'm from Star Communications. We're a marketing support company. And if you need help with your next marketing project, please call 273-1900, or you can go to our website, starcommunications.us.
And we're back with Professor Benjamin Weeks from Adelphi University in Garden City discussing Family Health History Day. Professor Weeks, now let's talk about some specific diseases that are affected in people that they can find out through knowing their family health history. Let's start with heart disease. Heart disease is the leading cause of death in the United States, as reported by the CDC. 611,105 people died in the United States in 2013 from heart disease. How does knowing your, and followed by cancer, which is the second leading cause of death. How does knowing you have a family health history help you with this information?
Right. Well, there are gene markers that will tell you if you're at risk for having high cholesterol, for example. Now, this is an example of gene markers that if one has that marker, doesn't guarantee you're going to have cardiovascular disease, but is something that can be managed. So once again, knowing this kind of health history can help you determine risk. Once you know your risk, if you're at a higher risk, or if your family has a history of high cholesterol and cardiovascular disease, you can start your screening for your cholesterol levels earlier, maybe as early as age 20, okay? Start to screen for those cholesterols. And when you get the screening, that's going to lead to treatment or advice from your physician that will help you with prevention for disease. The same is true with cancer. However, with cancer, in the case of the BRCA gene for breast cancer, this marker is a little more definitive in terms of what your risk is for developing the disease. So with the BRCA gene, you're at somewhere on the order of 1,000% more likely to develop breast cancer. This can lead to options of radical preventative prophylactic mastectomies, or might help you decide what kind of prevention treatment you might want to go through, depending on if you have the BRCA1 or the BRCA2 or exactly which mutation it is. So you can maybe alter what kind of treatment you would go through, and get your mammograms and your MRIs and your screening at earlier stages in your life. So really, knowing your family health histories allows you to do earlier screening, better prevention, because you're doing that risk assessment.
Right. And the same for colonoscopies, having those done
Yes.
at an earlier age than people who are not at risk.
This is right. So in addition to the BRCA for breast cancer, there are markers for colon cancer and others, but yes, by knowing if those markers are present, you start screening earlier, and you have a better chance at doing prevention. And then if you do have a disease, even the treatment plan will be potentially different by understanding other variable factors in your family history. So again, knowing the family history will be broader than simply the genetic background. The genetic background, knowing that your nature gives you that outline, that basic foundation. When you go in and see a physician, if you are experiencing disease and they're doing a differential diagnosis, deciding what to do for you, knowing your family history will also help your physician, again, not only do risk prevention, but also can affect the treatment plan.
And going back to what you previously said about nature versus nurture, if you're aware that these diseases run in your family, then you can take other preventive steps, such as modifying other risk factors.
Absolutely. So if you know that you have high cholesterol running in your family, not only can you screen for it sooner, but you can also make more important decisions in terms of your diet, what you eat, and start that in an earlier age.
Don't smoke.
Don't smoke. That's right. Don't smoke. Don't drink. These kinds of eat the right kinds of foods, and this will enhance your life, and also by knowing your family history. That's something you can give to your children as well. So if you know your family history and you're giving that to your children and that information to your children, you're going to raise them also to be more healthy people and have a better life.
Okay. So it's important to note that preventive services recommendations that incorporate family health history can improve health outcomes for those at increased risk. You can't change your genes, but you can affect your nature through nurture, as we were just saying.
Right.
There's some other things as far as nutrients and chemicals that you can discuss with our viewers?
Well, yes, certainly we know that having your vitamins, having your roughage, eating green leafy vegetables, the carotenoids that you would get in vegetables, these people who eat these types of diets do have reduced rates of cancer. The resveratrol, which is available in natural forms in grapes, in red wine, speaking of drinking, has some health benefits in terms of providing antioxidants to the body, reducing damage to genetics. Exercise is probably one of the best remedies. Even if you have a genetic predisposition, it doesn't have to manifest itself as a genetic disease. So how the genes are used can be affected by your lifestyle. Your genes are your story, but how you tell your story can be affected by what you do in your lifestyle, what you eat, exercise, and other habits.
I think that's a very important point.
Yes.
Would you repeat that, please?
Yeah, so the way I would say it is your genetics are somewhat set. They are set, and they're a story if you want. They're going to tell the story of your health. But you can tell stories in different ways and it still be the same story. So how you render yourself, how your life is rendered, and what you actually do still has a tremendous amount of wiggle room, though you have a genetic background. I'll never be the fastest runner in the world. I'm stuck with my genes. So with my genetic background, I'll never be an Olympic athlete for track. But I can go out and run and be healthier. And so that's an example of, or I can sit back and not be as healthy.
Okay. Now for some people, obtaining their family history is a little more difficult. For those who have been adopted, for instance, what important things should a person who has been adopted, should they know? Should they try to obtain 2 complete family histories, if that is at all possible?
Yes, if that's possible, getting 2 complete family histories will be important. It will be important to know your adopted family history. Once again, you might say, why? That's not where your genes came from. But if you've been raised on a certain diet or raised with around smoke or not around smoke or with certain habits, so certainly knowing your adopted family health history will be relevant. But if you can find your biological family and can then obtain some information, that's helpful. In the cases where that's not possible, there are screens out there for the gene markers, and you are able to go out. I'm not sure of the cost or the expense, and it's a decision you would have to think about, but if you can do some screening or understand maybe what your ethnic background is, because there are diseases, genetic diseases associated with certain ethnic groups,
Right.
At the very least, that would be something that might be helpful.
Okay. That sounds very, very important. Then, if it's at all possible, might be something to pursue.
Yes.
Okay. And so the objective of this initiative is to get families to share this health information, have people write it down, and to share it with their doctors and their other family members. Naturally, there may be some fears with regard to being tested and sharing this information. Can we briefly discuss two important acts by the federal government, the Genetic Information Non-Discrimination Act and the HIPAA Act with the Health Insurance Portability and Accountability Act of 1996 to protect patients' health information with regard to getting genetic screening?
Yes. My understanding is that what we call GINA, the Genetic Information Non-Disclosure Act, makes it so that health insurance companies are not able to say, if you're carrying a marker but you don't have a disease yet, but you're carrying the marker, they're not really supposed to be able to use that as a consideration for your providing your health care. The HIPAA provides privacy issues, so you can provide information to your physician, and a lot of this is protected also under the Affordable Care Act. This information is also protected so that employers are not allowed to discriminate against you because you may be carrying a certain gene marker. So it can be scary that a government or private industry would know something about the gene markers that you're carrying. Getting your family history, writing it down, and providing it to your physician and to your family members is safe and protected.
Mm-hmm.
And it's good to do.
It's very important for prevention.
Yes.
To help with preventive screening measures.
Yes.
So that would be why. But these are important acts that many people may not be aware of that are there to protect them. So to conclude then, incorporating family health history, preventive services, lifestyle changes, and environmental changes can improve health outcomes for those at risk. Can you take a few moments this year and become aware of your family's health history and write it down? Final comments about learning your family health histories.
Sure. I will say again that knowing your family health history helps you determine certain risks that you may be at. By knowing risks, you can then do some prevention. If the prevention doesn't work and you still wind up having a disease, it can affect what kind of treatment you have. This is something you can do for yourself, for your own health. It's something you can do for your children's health, your family's health, and of course we can all be healthier if we understand the risks that we're at. It is nature versus nurture a little bit. So you've inherited a set of genetics. You might say, well, there's nothing I can really do. That's who I am. That's what I got. And that is absolutely wrong. By knowing your family health history, including the genetic background and beyond the genetic background in terms of lifestyle, you are able to take the set of genes you have, your nature, and do the best you can with it in terms of having a happy, healthy life and helping your children have a happy, healthy life.
Wonderful. Okay. Thank you. That concludes our show today. Again, I want to thank my guest, Dr. Benjamin Weeks, Professor of Biology at Adelphi University. Please join me again next week for another Your Health Matters. Have a safe and healthy day and a happy Thanksgiving.